Hi, I'm Steve. Welcome to Virobus, and I'm with Karen Cox today. Karen, how are you today?
I'm great, Steve.
In the truest sense, you're really not an entrepreneur. You haven't started a business, but you are working in a very established, very regulated business, and you're trying to remake the business. Tell us about that.
Okay, actually, I work for Providers Care Network, which is a PPO. And if you know what that is in the healthcare world, it's a preferred provider organization, which basically we have a network of providers all over the state of Kansas who have agreed to basically a discount for their services. Then we in turn sell access to our network to the insurance companies that aren't the big insurance companies like the Blues and like United Healthcare and Coventry, who go out and do their own networking and contracting. Okay. So we enable there to be competition for healthcare in Kansas. We enable there to be choice, which without us, you just have the big insurance companies to go buy your insurance from. So that helps price. In the past, all we've been doing is selling the discounts. That's been key. But
what do you mean by selling the discounts?
Well, you know, our network is just, you know, the best discounts we can get makes us more attractive, which means insurance companies can sell their product at a lower premium, if you will. That's not enough today. That's not getting the job done. As you know, from hearing all the controversy and with healthcare reform nationally, you know, 16% of our gross national product is for healthcare, and it's going up every year at double digits. We have to change what we're doing. I'm in the process of turning that network into what we call a high-performing network. We're working with a group of physicians today that we're going to basically transform the way healthcare is delivered in this community. For example, it has been paid on a fee-for-service. Doctors get paid per unit of service, so they get paid more when they deliver more services. They only see their physicians or their patients normally when they're sick. We want to make sure that physicians get paid for outcomes instead of for the number of services they deliver. In other words, there's some incentives there for them to practice more efficiently, to work with their patients, to keep them healthy. And that's going to require some kind of incentives based on outcomes and quality. It's also going to require them to compete basically on quality. And so we're going to change it around completely. And that's what we're working on, because it's not been done here in Wichita.
I have several questions around that are floating through my head, so we'll just hit a couple of them. If I'm the businessman out there, I'm an entrepreneur and I'm starting my own business, and I have a few employees and I want to provide health care.
Right.
What does this mean to me? This
means that hopefully we're going to bend the cost curve. Because without that, as costs go up, it's passed right on to the insurance companies through premiums. It's passed on to the employer. You're going to keep paying higher cost.
And ultimately, it's the employee that's paying.
Exactly.
Even if the employer provides the insurance.
That's right.
It's money that could have been spent on salaries.
Everybody pays for it.
Yeah.
But not only are you going to see, hopefully, a slowdown in the cost increases or lower costs, you're going to have a healthier population. Your employees are going to be healthier, which is going to reduce your workers' comp cost. It's going to reduce their absenteeism, disability cost. It's a win-win for everyone.
Yeah. Karen, at Virobus, we talk a lot about entrepreneurs oftentimes are a technician, or they have a skill or a talent that they want to pursue. But the other piece of it is they've got to run a business.
Right.
This is part of that business side, isn't it?
It is.
And it can make a substantial difference for an entrepreneur that has employees to have a more economical healthcare policy system for their employees.
Exactly.
And so that's what you're working on.
Well, I mean, the cost is the big thing. The cost, and I would say the quality of life. I mean, it's no secret that more of our population have chronic illnesses today. Obesity is a big problem. All of those things add to the cost of healthcare, and it's passed on to everyone, and we can't afford it. I mean, it's got to stop. It costs more in this country than anywhere else in the world for our healthcare.
And for an employer, if their employees are healthier, they're more productive. They're at work more often, and they're doing their job better.
Like I said, it's a win-win for everyone. And the other part of it is we believe that physicians will get back to where they like what they're doing. They will truly be able to practice delivering healthcare. Today they're dictated what they need to do, how they do it. They run their patients through very quickly. It's just the nature of the healthcare delivery system. But if they can actually start working with their patients, see them stay healthier, get healthier, they're going to enjoy. They also enjoy what they're doing. I think there's going to be a lot more satisfaction in physicians' jobs.
I can tell that you're passionate about that. From a business standpoint, what's important for you as a business operator to be doing today in the 21st century?
Well, I mean, obviously technology, there's a lot of pieces and parts of our industry where technology lags behind many other industries. I mean, it's amazing. As much as we spend on healthcare, this industry is probably further behind in technology than any other industry in this country. For example, the health information exchanges that Obama has been promoting through healthcare reform, it's a big project here in Wichita and in the state of Kansas. That's going to enable there to be one system where all of our health information is housed and accessible to any healthcare provider. Take, for example, someone ends up in the emergency room and they're seriously injured or ill. There's no family member around. No one knows what medications they're on, what their history, what chronic illnesses they're dealing with. So they can make some big mistakes in treating that individual without that information. But think if they could go right to the computer, pull that person's name up, find out these are the medications they're on, this is what they're already being treated for. It can make the difference between life or death. It's a huge step in technology for our industry, and it will save millions of dollars and save millions of lives, I believe.
It's so interesting. Anytime we talk with entrepreneurs, technology is a huge piece of it, and keeping up with current information.
Yes.
It's just never ending, is it?
No, it isn't. And transparency is it's a big term you hear in healthcare. Most of us don't know how much a service costs. We don't know how good that physician is when we're looking for, shopping for a surgeon, if you will. But if through technology we could access that information and we could start shopping based on the quality of that provider and cost, that also will give us a better, I think, healthcare delivery system. We don't have that today. We're working on it, but...
And from the entrepreneur's point of view, they don't have any of that information either, do they? They can't make good decisions.
No, I mean, it's kind of it's been secret. And technology just hasn't been there in this industry.
And yet, I can go to Amazon.com. I can see every book I've ever bought from them. I can look at how people rated them, what they said about them, how they reviewed them. But I don't think my doctor could tell me how much a physical costs.
No, they don't know that either.
They don't know it.
No. There's no consumer guide for healthcare right now.
And that all impacts the entrepreneur, doesn't it?
Yes,
the business
it does.
owner.
Oh, it does. Yeah. Too many business owners just pay the price increases every year, don't really ask what drives that cost. How did my employees and their dependents drive that cost? What can I do to get the cost down? It's one of their biggest expense items on their budget sheet, but the one with the least information.
Yeah. Hey, thanks for that, and we'll need to get back together and follow your progress on this.
That'd be great. We're definitely going to make progress in the next few months.
Thanks, and join us again on Virobus.